Tomorrow marks World TB Day, and it will be observed under the theme, Yes, We Can End TB. According to the World Health Organization, at least 1.5 million people die every year globally as a result of tuberculosis. It's estimated that in South Africa, TB rates within the mining workforce are around 2,500 cases per 100,000 individuals, making mine workers more susceptible to the disease. Let's discuss this now with Dr. Chris van Straten. He's Global Health Advisor International SOS. Thank you, Doc, for your time here on eNCA. Just firstly, in terms of TB, just before I narrow it down to South Africa and our statistics here, particularly in the mining industry, so many millions of people dying from TB globally every single year. What are we doing wrong?
Sejo, first off, thanks for letting me join the call and focusing attention on this critically important topic. And first off, I loved seeing the piece that you just shared on Desmond Tutu. And if you don't mind, I'm going to quote Desmond Tutu because he was a legend. And he said, hope is being able to see that there is light despite all of the darkness. And that is a brilliant quote that has carried me through. And it carried me through at a time when I was personally battling TB. So I'm a TB survivor. I'm a South African doctor. Many South African doctors have either treated TB or have had and survived TB. It's not just limited to the mining industry. So first off, your question was, what are we doing wrong? Well, actually, before the COVID pandemic, we were doing a lot right. The numbers before the COVID pandemic, South Africa and the mining industry started in about 2013 to really knuckle down and make sure that they were measuring TB rates, that they were seeing what the main drivers were, and those numbers were coming down. And we were proud of that, really proud of that. During the COVID pandemic, much of the screening and therefore the picking up and management of these cases was disrupted, and those numbers have ticked up again. So I don't think it's fair to say that we were doing a lot wrong. We were doing a lot right. But I think we need to recalibrate now that we are seeing the COVID pandemic waning in many parts of the world. Thank you.
And Doc, because you're a survivor of TB, at least it means that you can get out of the woods if you just take the medication and take care of yourself.
Oh, yes. And it sounds so easy, right? I remember being a junior doctor 20 years ago, frustrated because I was working in the townships in around Khayelitsha, because sometimes my patients would come say, doctor, it's so difficult to take these medicines. And I go like, how difficult can it be? Let me tell you, those TB medicines are they have a lot of side effects. It can be difficult to take, but if with the right treatment, nutrition and support, you can beat TB. But it's a very long journey, and I think we underestimate how hard it can be. But yes, we can. We've got medications, but we need to support our healthcare system too to ensure people are getting the right treatment.
So when it comes to the treatment, I remember at one particular point it was 9 pills that a patient had to take all at once for TB. Is there no technology yet to make it one pill, like sort of like how they did with the HIV treatment?
That's a really great question. The answer is there's certainly a lot of ongoing work, and there's many ways that we have to look at TB. So yes, the first part is measuring. If you can't measure something, you cannot improve it. So measuring what is the incidence of TB, what's driving it, where are we winning, where do we need to focus? The second part, as you said, is can one simplify the treatment? And yes, there are different medication formulations where they've put those medications into, let's say, a single pill, so 4 in 1, RIF of 4 being the one example, and then being able to make it easier to take those medicines and follow up on that. And there is ongoing research, especially in terms of, because imagine if we do have vaccines for tuberculosis, but we certainly need more effective vaccines, but it's complicated. It's a very tough bacterium, and we need to figure out ways to prevent it, and as you said, ways to treat it. Thank you.
Just lastly, Doc, in terms of the mining industry, I mean, this is, of course, a huge worry in South Africa because the mining industry is also a huge part of our economy. We are one of the countries with a lot of mines. And so what is it exactly that companies and government can do to at least educate miners and make sure that maybe even the health department visits the mining industry more often to make sure that people are tested so that they are protected? And I mean, clearly people don't have to lose their lives, right?
Exactly. And again, I want to just bring attention to, it's nice to, well, sometimes it feels dramatic. Oh, we're losing. But if you look at pre-pandemic, what the Department of Health, what the big mining companies were doing in terms of how they were testing, screening, reporting, and then supporting those who were either sick or at risk. In other words, not just looking at the working environment, but what's in the community, what's the ventilation, how are people working. Remember, HIV and TB or immune suppression walk hand in hand. And so not just looking at the TB, but what are the other conditions like HIV playing a key role here. And they really were, the mining industry combined with the Department of Health and occupational health specialists were making a significant dent into TB and its impact, not just on the mining companies, but the individuals. And I think it's more a fact of saying, hey, let's refocus on what we were doing prior to the pandemic, and now let's focus again on, and it's like Tutu said, it's focusing on the light despite the darkness. We really were making fantastic inroads, and it's about focusing back on what we were doing right so that we can take it forward over the next 5 to 10 years. Thanks so much.
Doc, thank you so much for your time and for giving hope to those who are watching that it is possible to heal from TB. Global Health Advisor at International SOS, Dr. Chris van Straten.